Dr. Sue Beckham with the Cooper Institute. We're going to talk about low back pain today. Approximately 80% of adults experience low back pain. One of the most common causes is related to tight hip flexors. The hip flexor, more formally called the Iliopsoas, has two parts. One part originates on the low back or lumbar spine and inserts on the inner aspect of the thigh. The other part originates off of the iliac crest on the pelvis and also inserts in the inner thigh area. The hip flexors perform the motion of hip flexion, which is bringing the thigh upward. When we sit for long periods of time and do activities like cycling and running, we have a lot of hip flexion, which tightens up this muscle, the iliopsoas. When this muscle becomes tight, creates an anterior pull on the pelvis, tilting the pelvis forward into an anterior pelvic tilt. Long term, this can create muscle imbalances because tight muscles actually inhibit or turn off the opposing muscle group, which in this case is the gluteus maximus. One of the first steps in preventing low back pain is to lengthen the hip flexor muscle. Many times we attempt to do that with static stretching. However, if this muscle's been shortened for long periods of time, static stretching may not be effective as the muscle often develops microspasms, which we call trigger points. So hence we need to relax the microspasms before the static stretching is effective. And one way to do that is through the use of a medicine ball. To release the hip flexor, we'll begin in a prone position on the elbows and we'll place the body just over the medicine ball so it's just on the inside of the iliac crest. In this position, I'm going to shift my weight up on the ball. My feet will be wider than shoulder width. And what I will do now is adjust the tension by keeping more or less weight onto my left leg. My right leg, which is the hip flexor that I'm stretching, I'm going to turn the toe out and gently roll towards the thigh. I can also roll to the left or right to find the trigger point. Once I locate a trigger point, which is an area that either doesn't conform to the medicine ball or has a burning sensation, then I will spend about 30 to 90 seconds on that spot till it releases. After releasing the hip flexor, static stretching will be more effective. This is one of my favorite static stretches for the hip flexor. If you have a knee problem, this may not be the best stretch for you, or you may be able to perform the stretch by simply rolling up the end of the mat to provide some cushioning for your knee. So I'm going to stretch my right hip flexor. I'll step forward with my left leg and have a 90-degree bend at both the hip and the knee, and then I'm going to square my hips up so my weight is equally distributed across both legs and I'm not shifted to the right or the left. My lower leg is also in contact with the ground. My next step is to tighten my gluteus maximus and press my thigh forward. As I press my thigh forward, I'm going to also feel my big toe press into the floor, keeping my back flat and not arched. I'm going to reach above with the right arm until I feel a stretch right in this area. And I will hold it 10 to 30 seconds and repeat for a total of 60 seconds. To learn more about prevention of back injuries and corrective exercises, go to the Cooper Institute at www.cooperinstitute.org and register for one of our courses.